We're back here on the program, Jones and Company, and we have Dr. DrSands here, our new Minister of Health. Godfrey?
Dr. Sands, with reference to national health insurance, we as a people, don't we have a psychological viewpoint that healthcare is free?
Absolutely. A psychological viewpoint supported over many different administrations politically that is free.
Yeah, it's free.
Even though in the law and in the Gazette,
You're supposed to pay.
you're supposed to pay. And you do pay through your indirect taxes and through that portion of value-added tax that winds up being assigned to health. So health and education get the lion's share of the national budget. So my colleagues, when I go holding out my hand, say I need some more money, they tell me, no, don't come with that. Because you getting $300 million a year, you better satisfy.
So if you were to describe the quality of health care in the Bahamas today, how would you do that very succinctly?
I think that we actually enjoy quite a high level of health care, but we do not get value for money. We spend $2,500 per year per person, but our healthcare outcomes suggest that we spend far less. And so we waste an awful lot of the spend on healthcare, in part because the models that we have adopted are simply inappropriate for our needs. And so much of what we do should be discarded, revised, improved. And the first order of business is to look at, from start to finish, where is it that we're getting waste? Where is it that we're getting leakage or shrinkage? Where is it that we can do better? Because we're not putting our money where it's getting the most bang for buck.
And that the money should go where?
The money should go directly to patient care. Now, to give you a for instance,
Patient care, not prevention?
Well, I mean, it's the same thing. Prevention in terms of patient care, whether that's healthy lifestyles, whether it's nutrition, whether it's exercise, whether it's medication, all of that's together. But one essential thing that I didn't get an opportunity to talk about is the most important aspect of healthcare delivery is time spent or interaction with a registered nurse, okay? Now, you may say that's a peculiar reality. The truth is that in any healthcare system, probably the most important member of the healthcare team is the nurse, a registered nurse. In the Bahamas, we currently are losing registered nurses to North America at a clip that is threatening the survival of our healthcare system. So today, we have a shortage of more than 800 nurses. And this is despite importing nurses from the Philippines, from Jamaica, from Barbados, from Africa.
Why? Why do we have this shortage?
In large part because we really don't value nurses the way we ought to.
Meaning that you don't pay them sufficiently?
We don't pay them, nor do we respect them adequately. I'm speaking as a system. And so when I look at a nurse who, primarily female, although not completely, who completes a bachelor's degree in nursing, has significant on-the-job training, and then we say to that person, okay, we're going to start you off at $24,000 or $26,000 a year, okay? And a fella comes in and puts up a shingle in a hotel downtown and says, okay, we're going to give you a $5,000 or $10,000 sign-in bonus. We're going to give you a green card. We can pay you $70,000 a year. Last year in our critical care units, we lost 55 nurses, 55 last year. And so that beautiful critical care block that we have at Princess Margaret Hospital, we have beds closed because we've lost so many nurses.
You're competing with North America.
We are competing with North America, and our focus in the Bahamas has not been to invest on the single most important part of the healthcare system, the nurses. And I'm sure I'm going to get a whole lot of criticism from many different people about this, but it's borne out by the evidence. So let's say that we strengthen the terms of engagement of these nurses.
Yeah, but we can't compete with North America. You can't compete. You're not able, Dr. Sands, to give
So
a
you
nurse
inquest.
70,000.
So you inquest. I didn't say you got to pay 70,000, but maybe what we ought to do is to ensure that these persons earn a living wage, so that maybe they can afford a home. Maybe they can afford to educate their children. Maybe they can afford safe and reliable transportation. Maybe what we ought to do is to say that we ought not be spending $80 million on bricks and mortar. Maybe we should spend $50 million on bricks and mortar and change the terms of engagement of our professional nursing staff.
Dr. Sands, you have another problem. And in our country, we have made crime a police problem. All right? You made health a doctor's problem. All right? But the problem is our diet.
You're right.
That is why we have all these communicable diseases, and that is why the healthcare costs in the Bahamas are so high.
So you know you got to talk about agriculture.
Wait. The most important person in your ministry, Minister, is a lady by the name of Carmita Barnes. She's a nutritionist. All right? You need, as part of your primary care, you need a national nutrition program, because you're not gonna solve hypertension, diabetes, right, with people eating, Minister, processed, high sugar and fat content food. Because in the 90s, one of his friends introduced what I call this duty reduction policy, all right, which enabled, which they believe by buying cheap food, you're going to solve the,
So
all that did was exacerbate the healthcare situation.
I would say true, not necessarily causal or related. So it is true we got a lousy diet. It is true that we're fat. It's true that we have high blood pressure. It's true that we have diabetes, okay?
Yeah.
The question is, and I agree with you wholeheartedly that we need improved nutritional counseling and we need a better lifestyle coaching in terms of promoting physical fitness, getting people to move. The challenge is that if you look at all of these interventions across every country in the world, that the success of many of these nutritional or behavioral modification programs has been marginal at best. So we know what we have to do, okay? You know what you're supposed to do. Yeah. You just don't do it. Because people tell you straight and plain, if it tastes good, spit it out, okay? Don't put that salt on that food. Boy, she tastes good. Honey, you done had a half a gallon of ice cream. You don't need another half gallon.
I got hypertension.
I work hard. I bring me my ice cream, okay? So if you like it, let it kill you, okay? That is unfortunately the problem. So it's a multifactorial problem, just like crime is a multifactorial problem. And so I'm a realist now. I will spend an awful lot of time counseling people as to what they should do and how they should do it. And I try to be a reasonable example, okay? But at the end of the day, the overwhelming majority of people are not going to follow instructions.
That's true, yeah.
Okay?
Yeah.
Matter of fact, they can look at their medication, throw them on the ground, okay? They go into restaurant A or B, and they can have a big bosom woman. They can take this shovel, and they can throw 3 scoops of rice on the plate. Yeah. And they can put some macaroni, some potato salad, some coleslaw. Then can pour some gravy, grease on the food, right? And then, in a moment of atonement, they'll say, now give me a Diet Coke, okay? and that is the reality.
That's where we are, yeah.
So when we look, and we also have a cultural view that a certain size is appropriate. So if a young lady comes and she ain't got no gun cases, she ain't got no you know what, we don't consider her beautiful, okay? Our concept of beauty is you got to be solid. So it is bigger than that, just a simple thing about you should eat this or you should eat that. When we try to legislate healthy eating in the schools, okay? So you say to the vendors, you can't serve this and you can't sell that within a certain perimeter around the school. You know what happens? The PTA now brings in the donuts and they bring in the cakes to sell, cupcakes and so on and so forth, because they don't have to follow the rules. So, or they sell sodas because the children will buy it. So we have to have a multi-pronged attack on this thing. So yes, I support nutrition, but a number of our people who are 300 and 400 and 500 pounds are going to need bariatric surgery to have a reduction in the size of their stomach. Otherwise, we're going to lose them. They can drop dead.
Dr. Sands, it's always a pleasure to speak with you. And, you know, we have miles to go.
Time's too short.
Time is too short.
It is a real pleasure. I miss the opportunity to, you know.
We haven't even started talking the politics yet. You know?
Next lap.
Mr. Jones, you can invite him to On Point.
Yes, absolutely. We want you to come here as often as you possibly can find the time. Thank you.
Send the invitation. It's always a pleasure.
Good. Thank you so very much for being here today. Thank you, Godfrey.
Thank you.
Thank you for watching and listening to our program today, and I'm sure you enjoyed it. And Dr. Sands has pledged to be back here very often. Good evening, everyone.